Welcome, everyone. We're going to give just a couple more minutes to let folks join. We know it takes a little bit to get into the webinar, so we'll start in just a couple minutes. Good morning, everyone. We're going to give it just one more minute to let folks join, hopefully get into the webinar, and then we'll get started. Well, good morning, everyone. Welcome to today's webinar, and thank you for joining us. Let's go ahead and get started. In the interest of time, we have a pretty packed agenda. My name is Sarah Manji. I'm a policy officer at the Colorado Health Foundation, and I'm happy to be moderating today's webinar, State of the State's Budget, the Fiscal Outlook for Colorado state government and its impact on communities. For those of you who are not familiar with the Colorado Health Foundation, we work to bring health within reach for all Coloradans by engaging closely with communities across the state through investing, policy and advocacy, learning, and capacity building. So before we jump into the presentation, I want to just do a little housekeeping as we have over 200 people joining us on the webinar today. So we are recording this webinar, and we will send out the recording along with the presentation slides later in an email to all registrants this afternoon. So no need to be frantically taking notes on each slide. You will get the full presentation deck and the recording later today. We will also be adding these resources to our website in the next few weeks. There will be 2 short question and answer periods during this webinar. To minimize background noise, since there's so many of you, we have muted all participants' audio, but please type in your questions into the chat box at any time during the presentation. We also ask that if you're experiencing any technical difficulties that you also type that into the box, and we have a couple staff members checking the chat box regularly and can hopefully get back to you right away. So again, please chat in any questions you have. We'll have 2 short question and answer periods. So I would now like to introduce our wonderful presenter joining us today, Jennifer Miles, who's the founder and president at Frontline Public Affairs, a government relations and lobbying firm. Jennifer is an accomplished consultant with over 25 years of experience with an emphasis on health and human services in the policy area. She's widely recognized as a budget expert, which is why we have her joining us today. And prior to establishing the firm, she served for 9 years as director of the public policy for the Colorado Community Health Network, which is the state's association for community health centers. So without further ado, we'll turn it over to Jennifer. And Jennifer, we're so appreciative of you joining us today.
Thank you, Sarah, and thanks for that introduction. It's great to be here today, and I'm looking forward to this presentation. And think you have your first question there, Sarah, before we proceed.
Yeah, and I think we have your screen, so let's go ahead. Jennifer, most of us on the webinar today know that the COVID pandemic quickly and very drastically altered Colorado's fiscal outlook and state budget. So in the beginning of March, when we had no idea of the looming crisis ahead, what was the economic forecast? And by mid-April, what had already become apparent for the state budget?
Yes, well, Sarah, you know what they say, a picture is worth 1,000 words. And I think this first picture is a great example of that. What you can see here is what happened to the revenues to the state of Colorado. That top line there that shows your December expectations was where things were looking to be headed and around December 20th. And so when the legislature started in early January, that's what they were anticipating. Frankly, the Joint Budget Committee and the governor's office were proposing additions to the state budget, more spending in more areas, even after approving a lot of new spending in 2019. So then, of course, March rolled around, and you'll see what on this chart what the expectations were at that time. I will note this was about March 15th, so it was the very beginning of the quarantine and the shutdown. And frankly, the economists who put this together didn't have the markers yet to know even what had happened by the very beginning of March. And then, of course, you see what happened. The actual conditions to date is in reference to May 12th. That's when this was provided to the legislature. So at that point in time, or actually I should say in March, they were told they had $425 million that needed to be cut from the state budget in order to balance. And by May, that number had risen to $3.3 billion. So I do think it's important to talk a little bit more about the background behind this. This slide is a quick way of showing you for every $1 in taxes that you pay, where does it go? It's important to know that almost half goes to federal taxes. What we're talking about today is that approximately 1/4 of every dollar in taxes that you pay that goes to the state. And of course, the remainder there for locals. Specifically, what are the state's revenue sources? The total state revenues in a given year are almost $24 billion. You can see here that over half of that comes from what's called the general fund. And that is what had to be cut, $3.3 billion. And so you can see the primary sources of the general fund here: income tax, individual income taxes making up by far the biggest percentage of that category and the general fund overall, and excise taxes, with the state sales tax being the largest portion there. State revenues also include cash funds, which is about 10% of that total. These are fees paid, some specific excise taxes that we have in Colorado that are beyond the normal sales tax, lawsuit settlements, licenses and permits being kind of the biggest part of that. And then about $8.75 billion, over a third or 37% of our state's annual revenues actually come from federal funds. So as just a little snapshot, obviously you all know that income taxes went down, right? Unemployment shot up, people were furloughed. Raises didn't happen any longer. So obviously income taxes were going down. This gives you a little picture of what happened to sales taxes. And what you can see here at the bottom, and I'm sorry, this one's a little fuzzy, but at the bottom you can see that retail sales declined by about 8.7%. But I think what's interesting to note is that very top line, if you notice, food services and drinking places dropped significantly, right? And the only thing that increased there significantly was grocery stores. Makes sense, people still needed to eat, so they were replacing their food services and drinking places with stuff from the grocery store. But it's really important to note in sales tax, food items at the grocery store, unless they're pre-prepared, are actually not subject to sales tax. So you took that transition and you took it from something that was taxed with revenue to the state to something that was not taxed. So just a little picture that shows you what happened there. So we know that the general funds dropped significantly, right? What now? The legislature was basically faced with how they were going to do that cut. And as a quick reminder, according to our Constitution in Colorado, we must maintain a balanced budget each year. That means that spending may not exceed the amount of tax and fee revenue that the state collects or saves. In other words, that's very unlike the federal government. The state cannot run a deficit. So that May 12th news, as I mentioned, meant that they needed to cut the general fund for the next fiscal year, which is called Fiscal Year 2021, and it started on July 1 of this year. That was a 27% cut in the general fund. I should note that that's on top of some cuts that had to be made for the fiscal year 1920, the one we were still in at the time. The governor announced and state agencies had to make some cuts there. So how did they go about this? Honestly, they had proposals for cuts coming from a number of places. The governor's office, the Joint Budget Committee staff, and that's a committee that consists of 6 members of the legislature who are charged with writing the budget and presenting it to the full legislature. Their job became very different this year, and their staff worked very hard to come up with a variety of proposals of how the budget could be cut. Obviously, the JBC members themselves and other legislators had ideas, and then several interest groups proposed things that I would call lesser evils. They were scheduled to get a pretty deep cut, and they came forward and said, what if we did this instead? It's not quite so bad for us. When considering where to cut the budget, so they gathered all of that information, and then they're trying to figure out where to cut the budget. You kind of have to know what expenses the general fund pays for. And this is a great little pie chart that shows you just that. As you can see, over a third, 36% goes to K through 12 education, about another third to human services and healthcare. And then of course you can see higher ed at 9.1% and corrections judicial at 12.3%. Clearly those biggest pieces of the pie had to have some budget cuts when you're cutting 27% out of this pie.
That's quite a daunting cut that legislators and the governor were tasked with, Jennifer. So once they understood where all the funds were coming from and how much had decreased, how did they go about finalizing a balanced long bill in the next month?
That's a good question. It would be an interesting exercise to ask all of you how you would do it, what you would cut. So how did the legislature make these cuts and balance the budget? They started with a number of one-time or very limited measures. You can see that they borrowed from a number of existing cash funds. They reduced the state reserve amount significantly by $572 million. It's there for this purpose, right? To be used in a downturn. However, we'll talk further about this, but when you have to cut for another year and you've reduced the reserve this much, you've limited your options. They reduced state employee compensation 5%, suspended a transfer to state and local and school employees retirement fund. That's what PARA is. They reduced critical repair projects for state-owned building and property. When they started the year, they were planning to put about $450 million into that, reduced it all the way down to $3 million. And then they did pass one bill that increased some revenue, resulting in a need to cut less out of the budget. House Bill 1420 added $94 million in revenue that they hadn't previously planned on. But really, this wasn't enough. So if you add this all up, this comes to about $1.6 billion, though that doesn't include the state employee compensation. It's difficult to figure out what that total number is. But if we're at 1.6 billion, we still have to get to 3.3 billion, right? So then they started with the budget cuts. And here are some of the most major ones. Higher education cut by 58%. Now, in this year, that equaled the $450 million in federal aid that the governor allocated to higher education, plus an additional 5% cut. So it was really only effectively a 5% cut this year. K through 12 education had a 7% approximate cut. And again, schools received a little bit more than that, frankly, from federal funds. We saw community provider rates reduced by 1%. That affects almost all Medicaid providers, human services, local public health. They initially wanted to and proposed cutting two things that didn't pass, and they didn't end up having to cut: the senior and disabled veteran homestead exemption or Amendment 35 programs. Those Amendment 35 programs are constitutional. They require a 2/3 majority, and there weren't enough votes to get there. This list is a very busy slide of a bunch of examples of budget cuts that they also did that I pulled out based on some of the priorities of the foundation more so than anything. I'm not going to go through each of these, but you can see cuts to substance use disorder, safety net and teaching hospitals, dental, student loan repayment, family planning, assisting people with disabilities applying for federal benefits. This list of K through 12 education grant funds that got cut is daunting, and it's a lot of behavioral health in schools, frankly. and other things related to helping kids and getting better teachers. All of that was cut so that they didn't have to cut the per pupil funding. We closed a minimum security prison and reduced beds at another, and used $30 million that was directed by a bill in 2019 to go to affordable housing over 3 years to balance the budget instead. That's basically over 3 years, a $90 million cut to affordable housing. So those are just some examples. They were able to cut that $3.3 billion. At the same time they were doing these cuts, federal funds came in. Is that good news? Well, let's talk about it. Congress passed the CARES Act and Colorado gets $1.67 billion in federal funds with some really specific rules, okay? The first one being that it can't cover anything that was already in the state budget on March 20th, has to be spent by December 30th, and has to be related to COVID-19. The governor allocated all but $70 million through an executive order. You've got a link to that here. I'm not going to go to it right now, but you're welcome once you get the slides later to click on that and see how the governor allocated the vast majority of that funding. Some tension with the legislature, who felt like they should be given more, but they were given $70 million. And here's a list of the legislature's $70 million of CARES funds. You can see a variety of purposes here: small businesses, rental and mortgage assistance, eviction legal defense, low-income energy assistance to help people pay their utility bills, food pantry assistance, that when money goes to food banks and food pantries, mental health and substance use services. So I don't know if you recall in the previous slide, substance use disorder had a cut of about 20 million. The CARES Act came in and gave them 15 million, though some of those were mental health programs. Medicaid reimbursement for telehealth services, money for the 211 referral line, domestic violence programs, and some issues directly related to the pandemic, contact tracing at smaller rural local public health agencies, and work to increase immunization rates. Especially this fall, there's quite a concern that we need to make sure both kids and adults are adequately immunized for the flu, as well as those MMR rates in children. So that's how the legislature spent their $70 million. This certainly helped offset some of the cuts, though not directly because of the limitations around this money. So that's a lot of information.
Yeah, thank you. That was helpful, and albeit a little depressing in the beginning. I can't even imagine the daunting task that those legislatures had to do in making cuts that they certainly did not want to make. Before we move on real fast, I just want to remind folks that we're about to come up on our first Q&A, and so please, if you have any questions based on this first bit of information Jennifer's presented, please feel free to chat in a question. We will be getting to those briefly. So Jennifer, just moving on a little bit, we know that these budget cuts in the government, the state budget, have huge implications for nonprofits that rely on government partnerships and grants. You work with quite a few nonprofits. How have you been seeing this play out so far, and what do you recommend for nonprofits as they grapple with the new reality of this trimmed down budget?
Yeah, I think that's a great question, Sarah, and one I've been spending some time thinking about. First of all, I'll say that I think there are a lot of mixed messages right now to nonprofits. The state budget cuts on the one hand are telling you reduce your services, don't plan on any new programs that require state funds for a while. If you thought you were implementing something new this year, forget it, and it will get worse before it gets better. If we think back to those one-time methods that were used, it's going to be even tougher for them to balance the budget for the fiscal year after this one. Yet at the same time, this federal CARES money came in and said, spend lots of money right now before the end of the year, but don't count on more. But, well, maybe later if Congress decides on more or the November election results in congressional changes, maybe there will be more to help. But you better not count on it. So it's a hard place for nonprofits to be, for sure. I think that I wish I could tell you things were going to be better. I think we're all getting used to a lot more uncertainty in our lives. A couple of thoughts that I do have that I think could help nonprofits plan for the future. The future of the state budget is uncertain in an unprecedented way. Have contingency plans. I will let you know that state agencies have been asked to submit budgets to the governor with a 10% general fund cut for fiscal year 21-22. That's the one that starts next July 1st. With so many one-time measures that they passed, if there aren't new or increased revenues or new federal funds, as I've said, the state budget for the following fiscal year is expected to be even more dire. I will say that I think it will take several years before the state legislature will be able to add new funding to the budget or pass new legislation implementing new programs with a general fund cost. When this happened last time in the economic downturn of 2009, 08, 09, went into 2010 to extent. When they first did have the revenue growth return, they focused first on restoring some of the cuts that had been made. Though not all cuts will be restored, you still will have to prove the value of those things and the need for them. I would also advise folks to be strategic about pursuing non-government funding, including foundations and donors, looking for a way to generate revenue, and try to maintain somewhat of a reserve to withstand this volatility and the unknowns that you'll have for a while here. So I know that—
thank you. Go ahead.
I was just going to say, I know that's a lot of information so far. This is our first pause for a Q&A. And so we've got a little time for questions. And I think we've got Jean has been watching the chat box, is going to tell us what some of those questions might be.
Yes, thank you. And thank you, Jean. I'm going to turn it over to you and let you ask Jennifer the questions directly. And we should have time for a few.
Great. Thank you, Sarah. And thank you so much, Jennifer. I've got a few questions already lined up. The first is about economic forecasts. Could you discuss a little more how those are created, how often they come out, and how they really help signal either how dire things are about to become or how positive the situation may end up being?
Yeah, great question, Jean. The legislature, in particular the Joint Budget Committee, uses these revenue projections for budgeting, so it is important to understand where they come from. The revenue projections are presented to the Joint Budget Committee on a quarterly basis. And so that is generally around March 20th, June 20th, September, and December. And they're actually submitted by two different agencies, one being the Governor's Office of State Planning and Budgeting. A little later in the presentation, we're going to show you how you can access these revenue projections and can actually read them and follow them. So the first one comes from the Governor's Office. The second one comes from the Legislative Council, from their economics staff, economists who put this together. They work for the legislature. Those projections, if you look through the summaries of them, are interesting, but frankly, the longer documents are daunting, but rather interesting. Those professionals gather all types of economic data and information specific to Colorado and around the nation to provide that information to legislators so that they can determine how much money they have coming in, how close they've been to previous year budgets, and whether they need to make adjustments as a result or not. I will say that they had an interim one done. If you recall back to that first slide we talked about on May 12th. Because of what happened and because of the legislature's need to cut the budget so much, they asked for one extra one this year, and that was done on May 12th. Generally, the revenue projection that's released around March 20th, the Joint Budget Committee will choose one of the two revenue projections as their basis for balancing the proposed budget. And there's always a public presentation of those revenue projections on a quarterly basis that people can listen into. I'll show you how to sign up to receive them via newsletter in a little bit here.
Thanks, Jennifer. The second question is slightly related. You mentioned an interim forecast in May, but we're also in a different kind of interim between the session that just concluded and then, of course, the next one that starts in 2021. What happens during this interim, and what are the opportunities for, say, the legislature or even the governor to act on any perhaps new information that may arise or other kind of externalities that pop up around budgetary issues?
Yeah, good question, Jean. Normally during the interim, there are 3 of these revenue projections that occur because they occur around June 20th, September 20th, and December 20th. The only one that occurs during the session normally is the March one. And so What the Joint Budget Committee does in the interim is monitors how things are going. Frankly, every year in January, they come back and do what are called supplemental bills, where they look at the budget for the current year that they're in and figure out how close they were or how far off they were. And they make adjustments. They're kind of boring bills, but it's a regular part of the budget process that they make a mid-year adjustment every year around January. They just had their revenue projection on, I think it was June 19th this year. Because of the delay and in the legislature this year, they finished on June 15th and had that revenue projection on June 19th. Of course, normally they finish around May 10th, but we had that 10-week break because of the pandemic. What they did learn in June is that they did enough so far to cut the budget, and more didn't need to be done by the governor during the interim. If the reserves go below a certain amount, the governor is authorized to make budget cuts during the interim. So as of June, the news is that that will not have to happen. We'll have to watch that again in September and December. And the governor's office may need to make some cuts while they're not in session.
Thanks again, Jennifer. Switching gears a little bit to a topic you did discuss in passing, which is cuts to para. Can you describe the cuts that specifically impact teachers?
Sure. So para is the Public Employees Retirement Association. It is the pension fund or the retirement fund for not only teachers, all public school employees. So nurses, janitors, bus drivers, superintendents, administrators, etc. It also is the retirement fund for state employees and most local government employees in the state as well. So your public health workers and so forth. Last year, the legislature had decided to do a series of payments from the general fund to para to shore it up and to make sure it continues to be viable and not have to have cuts. And so what they did is suspended this year's scheduled payment of $225 million. I am not certain, and in fact, I don't think that that one payment makes any difference to current pensioners who are getting paid through that right now, nor at this time for the future. It was meant to be a payment to shore up that fund. Now, obviously, without a payment to shore up the fund, you start to wonder about its viability long-term. And I do think it's something that they will need to return to at the legislature to determine if they need to do more to shore up that fund in the future.
Great. The next question that I have for you, Jennifer, is specifically about how legislators have looked at budget cuts. The question that came in is around if you think that legislators were mindful of how their decisions were impacting traditionally economically depressed regions like the rural and frontier communities that we have in our state.
You know, I would say that legislators had a pretty good knowledge of how deep these cuts were and how difficult they would be, as did the staff. There were literally times during the Joint Budget Committee where legislators were in tears because of the decisions that they were having to make. Now, obviously, each of them represents a certain district and are probably more attuned to their district and its needs. But there are a number of rural legislators who bring that issue up. There are a number of legislators, the Black and Latino caucuses, for example, set some of their own budget priorities and put out there for the rest of their legislative colleagues some of the things that they thought were critical not to cut. And so all of those things are part of the discussion at the legislature. Certainly it's important that advocacy groups and groups that provide services to folks in different parts of the state are vocal about that as well. So legislators know the impact of the cuts that they're considering. But that was all part of the process this year, definitely. Going back to para for just one moment, the reason it's such an example of a one-time measure is it didn't have much of a negative impact on anyone right now. And so those are the kinds of things, as I mentioned earlier, that they tried to depend upon.
The next question, Jennifer, is about public health funding. Could you speak a little bit about the differential in funding across public health, specifically with regard to the federally qualified health centers, the community health clinics, and even the local public health departments?
I sure can. I don't know if the person who chatted that question knows this, but I've represented the community health centers for a long time, and I also represent the local public health agencies. So those are funding for those particular entities are things that I work on a lot. Frankly, healthcare wasn't cut as much as you might think in this budget. And when I reflect upon why that happened, I think it's partly because we were in a health pandemic. And so legislators were hesitant to cut health clinics. Obviously, they were hesitant to cut local public health. They were on the front lines of this entire pandemic. And so by and large, the areas of the state budget for those entities, and that includes community health centers and other community clinics, were not cut. So for example, the primary care fund, the Colorado Indigent Care Program, the clinic program, those line items were not cut. Same with local public health agency general funds. I also think that a main thing that happened was that a number of federal funds came in, and the federal funds that came to the state of Colorado, much of those, once you get the presentation and you click on that executive order, you'll see that much of those went to the state health department, some of which was passed through to local public health agencies to handle the public health aspects of this pandemic. And so that also helped. And then there were some direct payments to federally qualified health centers, included in what Congress passed. And some direct federal monies coming that got distributed to local public health agencies directly too. So one thing that I think was kind of frustrating this year is some things are almost off budget because the governor took the $1.6 billion and allocated all but 70 million of it, but none of that shows up in the actual long bill or the budget documents the legislature shared. So it gets a little bit more difficult with that to track what's happened. I know that some of the community clinics that are not federally qualified community health centers didn't get as much in terms of direct funding, though there are some provider relief funds that came through to several providers in the state who have participated in Medicare or Medicaid. Again, those came directly from the federal government to those providers. So we could probably do an entire presentation just on funding for some of the safety net in healthcare, but there are some basic responses to that question.
Thank you, Jennifer, and thank you, Jean, so much for those thoughtful questions and for grabbing them out of the chat box. I know we didn't have time to get to all the ones that have been chatted so far. We do have a final Q&A at the end of the presentation, but I think we're going to move on to the next portion of Jennifer's presentation right now. So pivoting a little bit, Jennifer, can you show us can you share with us some of the key places online that organizations can pull helpful budget information from? I know the state website can be a little overwhelming and you know all the places to look.
Yes, thanks, Sarah. Yes, we're going to do a little bit of live, go to the internet, give you some pro tips so that you can monitor some of this on your own. And I'm actually going to move from this slide to the website itself and kind of drive through some of it. And so first off is the General Assembly's webpage is leg.colorado.gov. And if you go there, you see obviously this screen here. Now I will note that this can look different depending upon the size of your computer. On my larger computer, I have these buttons across the top. But on this laptop that I'm using right now, I have instead this drop-down menu off to the side. And so the first thing that we're going to do is pull down that drop-down menu, and we're going to go to budget. But don't click here. You want to pull the arrow down, which if you have the buttons at the top, you're just going to hover. And we'll go to explore the budget. This is a great place to start and to get a good overview of Colorado's state budget. It has some of the basics here that you will see. Some of the budget sources. So these are the general cash funds and federal funds we were talking about. The timeline that they work under to prepare a budget. How big is the state budget? You see here some good graphics, that some of which I borrowed for this presentation. What is the budget? Exploring the state budget a little more. So anyway, there are just a number of really good things within here, and I encourage especially those of you who are new to the budget, but frankly, even if you're not, there's a lot of great information right here. So then if we go back to that home page, this time we're going to just click on budget itself, and this gives you basically the main budget page on the internet for the state of Colorado. It's organized kind of differently, again, if you're on a larger screen, so yours might not look exactly like this. But importantly, when you scroll down a little here, you can click on the JBC schedule. You can tune in and listen to them. I think some of the other things that are really helpful to read, that this long bill itself is going to be just a series of numbers and be confusing. Even for someone like me who's been doing this long, I prefer to look at the narrative, the long bill package narrative that uses real words to describe what's in the budget and what some of the cuts are. Also within here is a budget documents table. Every fall in November and December, the Joint Budget Committee staff put together some really helpful documents on the budget requests from the governor's office and the budgets for each state agency. You can sort this by department topic. You know, you can choose healthcare policy and financing. You can check the dates that you want, but these documents put together by the staff are helpful and interesting. You would learn a lot from looking at them. You'll also see on this main page back here for the budget that in this box, you have the option of clicking on the Legislative Council staff economic forecasting or the governor's office. We're going to go to the Legislative Council one here first. And what you can see here by scrolling down a bit, you can click and open up these economic and revenue forecasts and find them by calendar year and month and look at them. There is also a place here. Let's see, where did I see that? Oh, right here, you can subscribe to the economic and revenue quarterly forecasting mailing list. And so what they send out each quarter is a link to that big document, but also a really good and helpful summary of what is in the document, the main findings. And so if you're wanting to become a little bit of a budget nerd, you might want to sign up to receive those. Going back to that budget page, you can also click here on the Governor's Office of State Planning and Budgeting. And they have a similar spot here. Let's see, and what I found here is that once you get here, it's going to be easiest to click on economics. And notice up here, there's a newsletter sign up. And so that would allow you to get a similar kind of email from the governor's office every time they do these projections. And down here, you can click on and read the June 2020 forecast from the governor's office or click on the past forecast. So those are a few pro tips. The other thing I like to tell people is that generally, when the bill is introduced and it has an impact on the state budget, the legislatures, the staff, the economists do what's called a fiscal note. And those are really helpful to know about because they provide a plain language summary of what the bill does. So if you've ever opened a bill and thought, oh, this is legalese, this is hard to understand, you can know that looking up a fiscal note is a better way to get a basic explanation of the bill and its impact on the budget. And so I don't know if you saw me do that, but I went back to that main menu, clicked on bills, and then the screen pops up asking me to search by bill. If you don't know a bill number, you can search it up other ways, but I'm just going to put one in here. I think I did House Bill 1085. Okay. This is also just helpful to know generally. When you put in a bill number like that or get to a bill number, you can open what's called a bill folder. And within this bill folder is a lot of information that's helpful. A summary of the bill. Before we go to that fiscal note, I'll just show you a few of the other things here. You have the sponsors, the committees. Down here you have a status, and in this menu you can look up the bill text, the fiscal note, committees. The bill history is something that's often very helpful. If you go back up to the first screen that came up, you can view the recent fiscal note. And so as you can see here, this one was done very close to the end of session, and it goes through and identifies, down here you'll see a really good summary of the legislation. Again, this is the plain language summary we're referring to. That's usually better than the bill itself. And then the fiscal note goes on to describe what the bill does. Interestingly, this bill was just vetoed, but I'm using it as an example to show you the kind of information you can get within a fiscal note. I'm curious to check, and I'm going to check with you guys on the call right here. If we go to the bill history, it says right there at the top, the most recent action, governor vetoed. Okay, so those are a few pro tips that I hope you find useful. They've done a lot of work on the state legislative website, and I think it's gotten easier to use over the years. So hopefully that will help you have some places to go and some resources at your fingertips.
Thank you, Jennifer. That was incredibly helpful to just watch you go through the website and see where we can kind of shortcut to some of the most helpful information on there. Before we move on to our last question and answer period, I do want to ask you one last question about looking into the future. If you had a crystal ball, do you or could guess what's coming down the pike, what fiscal relief or good news might be on the horizon for Colorado's budget in the next couple of years?
Yes, so I thought about this question. Is there any possible budget relief? Yes, well, maybe. So let's talk about it. There are three main ways that we can have some budget relief in Colorado. One is a simple economic recovery. The state revenue will likely increase and return to normal when the economy does finally recover. Of course, this is an unprecedented incident, so we don't know for sure how long that will take. The last economic recovery took 2 to 3 years for revenues to rebound to previous revenues. So the kinds of things that we're going to be watching for would be income tax collections, unemployment numbers, evictions and foreclosures, permanent layoffs, business closures. If those things keep going south, we're in trouble. But if we see some things improve there, we should see the revenues rebound as well. Federal funds for state budget relief from Congress, that of course is a very big question mark. They have, after passing the initial rounds of support, they've had trouble coming to agreement on what else to do and how much to do for states. That could change at any time, including after the November election when the new Congress starts in January. In terms of state revenue itself, there are a few things on the horizon that could help. One is that a referred measure was sent to the ballot by the legislature to add a tobacco or vaping tax. And that is slated to raise money for K-12 schools and affordable housing in the initial years, and then later for increased tobacco education and prevention activities and universal preschool, which the governor would like. That would take some pressure off of the current general fund revenue if this new revenue came in. That will be on your ballot in November. The Fair Tax Act or Fair Tax Movement is collecting signatures for the November ballot. And so we don't know if it will be on the ballot yet. Those signatures are due, I believe, August 5th, and then there's a period of time for the Secretary of State to verify them. But if this does appear on the ballot, it would lower taxes for over 75% of the population. Anyone earning less than $250,000 a year would actually see a slight decline in their state taxes. But it would increase taxes for people in income brackets above that. The highest rate would be 8.9% for those earning over $1 million a year. And then it goes from the current tax rate of 4.63% for income tax up to that 8.9, depending upon where you are. Right now, Colorado has in its constitution a flat tax. Everyone pays the exact same percentage. And so this would remove that from the constitution, move us to a graduated income tax, and it would raise $2 billion a year. It is Tabor exempt, so the state would be allowed to keep and spend it. That's important. I've included a link there, and you can go to the campaign's website and learn more about it. I mentioned that one of the things the legislature did was raising some revenues. They did that through House Bill 1420. that decoupled Colorado from some federal tax breaks. Colorado is only one of only 2 states where when a federal tax cut happens, we automatically include it in our state taxes as a cut there as well. The legislature, without going to the vote of the people, can decide to decouple from these federal tax breaks. And so they did some of that. There was a lot of talk when they compromised at the very end and took some of those decouplings out of that bill, that they would be looking at that again over the summer and fall, and possibly bringing legislation in 2021 to do further decoupling from the federal tax code, bringing in more state revenues. Finally, the Gallagher change to the Gallagher amendment was referred to the November ballot. This would reset property tax assessments. Colorado is among the lowest in the nation for residential property taxes, and we're among the highest for commercial, so that ratio. Now, this primarily affects local government. However, it greatly affects the amount that local governments put into K through 12 education. And to the extent that they can put less and less into K through 12, the state budget has to make up the difference. So those are kind of the main ballot issues. The tobacco tax and the Gallagher change were referred, so they're automatically on your ballot by the legislature. The fair tax is collecting signatures and trying to qualify for the ballot. Now, I will note there are a bunch of other potential ballot initiatives. These are the main ones related to state revenue or that would increase state revenue. There's one that actually decreases state revenue. And we've included a link there to the Secretary of State website so you can go look at potential ballot initiatives at the state level. There are a lot of them.
Thank you, Jennifer. It's certainly going to be a fascinating election this year with potentially huge implications for the Colorado budget ahead, but hopefully some good news on the horizon. We could hope.
Yes. All right, so we are going to do our second Q&A period and take some questions from the chat box that Jean has been collecting for us.
Yep, I'm going to turn it back over to Jean.
Thanks, everyone. So why don't we start the second Q&A talking about Tabor. How about a question for you, Jennifer, around your thoughts? Did Tabor exacerbate the crisis? And do you believe that the current crisis has changed public opinion on Tabor?
That's a good question, Jean, a complicated one as well. Did Tabor exacerbate the crisis? You know, one of the main things that Tabor does to the state budget is that it has to be balanced and can only spend in a given year all the revenue and fees that come in. That includes any reserve, any savings has to come out of the annual revenues and can only be used as savings for that fiscal year. And the next fiscal year, they have to find more money. So that has kept the state of Colorado from keeping any kind of true rainy day fund, from saving in the good years, so that in a time like this when revenues drop, they have a fund to draw from to keep the budget cuts from being so drastic. So that is certainly one way. You know, I think that others would probably argue that Tabor has kept our tax rates lower and our government spending lower. And in fact, if you look at how we compare to other states, our state budget is a smaller percentage of our total economic activity or GDP in Colorado than in some other states. If that had not been in place, it's possible these budget cuts would have been even deeper because we might have had a larger state budget. So certainly some pros and some cons. Now, whether it's changed public opinion about Tabor, that's always a complicated topic because Tabor does so many things. I'm not sure that the pandemic has made the public any more comfortable with the legislature approving tax increases. They probably would say they still want tax increases to come to a vote of the people. Now, is the general public understanding that we have some fiscal constraints in Colorado that other states don't have that is making it more difficult for us to respond? That's a good question. I'd be very interested in some polling to see if voters are thinking about that. I think when you have an economic downturn like we're experiencing now, obviously more people are experiencing the negative results. Unemployment is very high. Businesses are closing. People are sick. And if you aren't, you know people who are being hit. And so I think sometimes that makes people understand better the importance of government services. Unemployment compensation is there for a very good reason, and here's an example, right? Likewise, some other types of government services, be that healthcare assistance, food assistance, whatever people are needing, are probably a little more valued right now than they may have been prior to this.
Great, thank you, Jennifer. The next question is about Amendment 35 and something that the legislature did not do, which was they did not declare a fiscal emergency in order to reallocate Amendment 35 dollars. So would you mind explaining what Amendment 35 is, and then why the legislature did not declare that fiscal emergency, and if you believe there are additional opportunities to do that in the future?
Yes, good question. All right, Amendment 35 was a ballot initiative that passed in 2004 that raised our state's tobacco taxes, tobacco, cigarettes, and other tobacco products. The constitutional amendment indicated that the additional revenue that came in would be dedicated to some specific purposes, primarily healthcare. The primary care fund is for health clinics that serve low-income uninsured populations. The Medicaid and child health plan programs receive revenues from Amendment 35. There's a couple of programs at the State Health Department, the Cancer, Cardiovascular, and Pulmonary Disease Grants Program, the Health Disparities Grants Program, and Tobacco Education Prevention and Cessation. Local governments also get some funding from that Amendment 35 increase. When it passed, the constitutional language included the ability for the legislature to use those funds for balancing the state budget, for helping to pay for Medicaid and CHIP, essentially, if the legislature and the governor, with a 2/3 majority, declared a fiscal emergency. And so, when the Joint Budget Committee was reviewing their options for achieving a $3.3 billion budget cut, this was one of the items that their staff brought to them. Back in 2009 and 2010, the legislature did declare a fiscal emergency and use Amendment 35 to help balance the budget for Medicaid and CHIP. And so their staff brought that to them, and the Joint Budget Committee voted and agreed to bring that forward to the legislature. So what happened next is the House Republicans decided to take a stand that they didn't want to see cash funds that were devoted to a specific purpose borrowed from and used to balance the budget. Without any House Republican, you couldn't get to a 2/3 majority in the House, and so they weren't able to get that passed. There was a lot of negotiation to try to make it happen, but ultimately they couldn't get enough votes. What does that mean for the future? Does that mean Amendment 35 programs and those of you who might be funded from those are safe and you won't ever see a budget cut? Not necessarily. Keep in mind that we will have deeper cuts next year, and we will have a lot of changes in the legislature. Honestly, those were the more conservative Republicans who took that strong stand. We're frankly going to see the Republican Party in the House is going to shift a little. It's not going to be quite as conservative. In a number of primaries, the more moderate Republican won and is likely to be in office come January. So I certainly foresee that the Amendment 35 programs will be discussed again and potentially proposed again, and possibly a cut to those programs could pass in the future.
Great. I think I have a couple more questions for you in the time we have remaining. The first of which, to bring us home here, is about cuts to state-funded senior programs. The question in the chat was specifically around cuts to a benefit for low-income senior dental programs, but are you familiar with any other cuts that specifically impacted our older Americans?
You know, that's certainly the primary one, the low-income senior dental program. Last year was able to get a $1 million increase and have that budget move from $3 million to $4 million. That was pretty important because the program was running out of money before the fiscal year ended. Those low-income seniors who didn't have any other dental assistance or insurance of any kind that depend upon that program were being told in March that they couldn't get what they needed until July. So that increase was important, but it was cut this year. So the program lost $1 million and went back down to $3 million. That's the primary one. Certainly seniors in our state benefit from the senior homestead property tax exemption. And there was discussion of removing that or cutting that, but that was not successful. That is a program whereby seniors can have, they're exempt from paying property taxes up to a certain value of a home that they own and live in. And so that's a relief for a lot of seniors in our state. Frankly, the budget in Colorado doesn't include a whole lot of things specific to older Coloradans. A lot of those funds are federal, but that's the main cut that I am familiar with.
All right, and my last question for you, Jennifer, is around a little bit of comparison between and amongst Colorado and other states. Do you happen to know how we compared to the situation in other states? And is there anything that we did in our state that was particularly unique during this crisis, particularly from a fiscal standpoint?
Well, I think that's a good question, and there may be others who know more about this than I do. What I do know about this is that Colorado is one of a few states, we're the only state that has TABOR exactly itself, right? But we're one of only a few states that has the kind of limitations on revenue collection and spending that Colorado has. Most states do have a requirement for a balanced budget. We're not unique in that manner, but many of them have more flexibility, the ability to have rainy day funds, reserves, borrow, a variety of things that we cannot do in Colorado. So it's a little hard to compare us to other states. I mentioned as well that our state budget is about 10% of our state's GDP, and that's below average, pretty well below average, frankly. Our income tax rate is on the lower end. And so all of those things led Colorado to a somewhat unique place. They couldn't necessarily follow other states and use their examples. In terms of anything unique, in some ways it was all unique because we're in a little different situation than the rest of other states.
Thank you, Jennifer, and thank you, Jean. That's all the time we have for questions today, but you covered a great deal of information, Jennifer, and I know folks probably found it incredibly useful. Any last thoughts to close out your portion, Jennifer?
I think just what you see on this last slide, that again, as Sarah said, you're going to receive an email with a link to this presentation and to the recording. And up next, which I think you're going to say a little bit more about, Sarah, the Colorado Health Foundation has a local government budget webinar on August 4th. What else can you tell us about that?
Yeah, thank you so much. And thank you again, Jennifer, for your time and expertise today. And thank you, everyone, for joining us. We know that you are incredibly busy right now. So thank you for taking an hour out of your day to be with us. Again, actually this afternoon, you'll get an email with a link to the recording of this webinar, along with the slides from Jennifer, and the links that she showed for the budget web pages should be live in those slides, so you should be able to click. I also wanted to quickly highlight two more upcoming learning opportunities the Foundation's hosting. The first is a chat with our CEO and President, Karen Macneil Miller, which is on July 23rd, and it's titled, "At the Heart of the Matter, Our Race Shapes Our Realities." So more information and a registration link will be coming out, I believe, actually tomorrow. So check your email for that if you're interested. And then as Jennifer mentioned, a second part of our budget webinar series is coming up because we know that many of the same fiscal dynamics that impact the state budget are repeated at the local budget, with severe budget cuts expected in cities and counties and other local governments in the months ahead. And we know that you, nonprofits, rely heavily on local funding and support. So on August 4th, we'll be hosting a webinar that goes through we obviously can't do all local budgets around the state, but really dives in to what local cities and counties are dealing with right now. And registration for that should be in your email box at the end of next week. So we hope you can join us for that one as well. So thank you again, everybody, and Jennifer, and we will talk to you again soon. Have a great day.